This is Dr. Salma with American and UK Ozone Aesthetics. We are here today at AASP 2024 conference. And today we're going to be talking with lots of people who are the lead and great in doing what they do. So check it out. We're going to be talking with a whole list of dermatologists, plastic surgeons, and many, many more. All right, everyone, here we are back again with another amazing doctor, Dr. Mughese Amin, and we're going to be chatting with him. So let's welcome Dr. Mughese Amin.
Thank you very much.
So, doctor, tell us a little bit about yourself. What do you do? Where are you from?
Basically, I belong to Bahawalpur. Bahawalpur is a small city in the south of Pakistan.
Yes.
And it is basically one of the states who agreed to go with Pakistan.
Oh,
And
okay.
it is one of the richest states of Pakistan. And they supported Pakistan when it came into existence in 1947. And it's a city of palaces, you know, it's one of the most beautiful cities in Pakistan and sub-Saharan India. I'm working there as professor of plastic surgery in Qajar Medical College.
Amazing. So I'm sure you guys didn't know all the history about the city. So now you know. Go make sure you go and visit the city and also see the amazing doctor here. So you are a plastic surgeon.
Yeah.
How did you get into plastic surgery, or even kind of this whole field of surgery, plastic surgery? Share your experience or your journey a little bit.
I actually belong to a family of doctors.
Okay.
My father was a professor of surgery. My mother was a gynecologist.
Okay.
And to be a plastic surgeon was my passion since my childhood. And, my passion came true,
Yeah.
And I became a plastic surgeon. If you ask to my colleagues who were in my school fellows, even they know that he wants to be a plastic surgeon at that time.
Amazing. It happens so often that children who grow up in a household where there's, mother, father, families are doctors, sometimes they just want nothing to do with it. But you were the complete opposite. You knew what you wanted to do from a very young age. Okay. All right. Well, that's amazing. So what is the most common, most common patient in your practice?
In Bahawalpur, when I came to Bahawalpur, there was no existence of plastic surgery. There was no plastic surgery department. There was no concept of plastic surgery. I came back from UK in 2004.
Okay.
And I developed a plastic surgery department there. There are two different spectrum of patients which we treat. One spectrum is the reconstruction one, in which we treat the burns, head and neck cancer, all kind of congenital deformities.
Yep.
Hand contractures, trauma. We work with neurosurgery department, orthopedic department, ophthalmology department, ENT department, and help them out, figure out their soft tissue deformities.
Yeah.
And the other spectrum is the cosmetic spectrum. And there we do a lot of these liposuction, cosmetic procedures like facelift, nose job. I do a lot of hair transplant.
Okay.
And I'm one of the pioneers of hair transplant in Pakistan.
Amazing.
I started in 2003-4 hair transplant. And then we do all kinds of non-surgical aesthetics, all the latest procedures.
Fillers,
you name
Botox,
it,
and threads
we do
and
it.
everything else.
These are old procedures.
Yeah.
We are doing like SVF, we are doing Profilo, we are doing polynucleotides, we are doing the fourth generation threads, we are doing everything. In Bahawalpur. Yeah.
Namika and everything else.
Yeah.
Well, the Namika is a great thread, of course. So do you feel, what is your challenge in your practice? What is it, one challenge that come across a lot?
Well, honestly speaking, the challenge regarding cosmetic surgery is definitely the cough. That is in my area. It is, the biggest challenge that patient usually feel. And then I think Pakistan is growing like anything. There are no social taboos or anything. People are coming up with their issues, with their problems, and usually we do not have any social kind of issue which you, I think, trying to ask, but they're not there.
Okay.
And we sometimes feel, limitation regarding equipment and stuff. But nowadays we have everything. Even in Lahore and Karachi, people won't have that equipment which I am having in Bahawalpur.
Because you are a pioneer, you're bringing in all these new technologies and making sure that the patient gets the best care.
We do a lot of, non-shaven long hair transplant, which nobody else is doing in Pakistan by FUE.
Yeah.
I bought the first machine of long hair, non-shaven FUE. I'm doing Vaser liposculpturing for the last 12, 13 years now. I have
That's
my own
amazing.
Vaser and everything there. And
So you are actually taking the responsibility yourself to bring in everything. You're not waiting for something to happen, but you are making it happen yourself.
Yeah, we do that.
That's amazing. So so overall, if you look at patients, like for example, somebody coming in for a hair transplant, even a liposuction, when patients come in, so do you feel that the patients are ready to make a change in their life? Are you or are they just looking for just like a quick fix?
Definitely, you have to, when a patient walks in, you have to see what his aims and objectives are.
Right.
Whether they are realistic or they are non-realistic.
Yeah.
All the cosmetic patients which are coming in with non-realistic, expectations, they are not good candidate for surgery. Definitely, when a girl's come in with a nasal hump and she thinks that that is a stigma for getting her to be married, that is a very realistic expectations.
Yeah.
But if somebody comes in and says that her husband don't like her or the mother-in-law don't like her, she want to get this thing corrected, then that is something, tricky and fishy.
Yeah.
So you have to, and definitely most of the patient nowadays, it's a time of media, everybody is well versed,
Right.
They know about.
Maybe a little bit too much.
Huh?
Maybe a little bit too much.
Yeah, it's too much. They know more than the doctor. Yeah.
Sometimes false expectations are quite high.
Yeah. And they sometimes tell the doctor that they want this procedure and this product to be done, which is sometimes dangerous as well. Yeah.
That is true. Yeah. Sometimes false expectations comes with dangerous expectations. Well, you're very right. And yes, it is, talking to everybody, it's always a thing about just being able to, connect with the patient, understand the patients, make sure they're ready for the change that you are about to make as well.
That's right, yeah.
So thank you so much for bringing all this amazing technology and telling us the history of the city that we didn't know about. And we'll be happy to just, we look forward to just connect with you again.
Definitely.
Coming to your city.
Welcome. You're always welcome.
All right.
I met David. He's an amazing guy. And, I'll also drop into your...
Absolutely. Yeah, we're here in DH4 and then in Islamabad in DH2.
Welcome.
Yeah, thank you so much.
Thank you very much.
All right.